Good morning, everyone. My name is Kajal, and I'm talking about the subject which is clinical sample collection. So, the subject code is 3056, and the topic is Principle of Management with special reference to medical laboratory science. So, today basically we are going to talk about what is sample collection and what are the procedure we do in sample collection, what are the precautions we have to take while doing collection, in what type of a vacuum we have to collect the sample. So today we are going to talk about the same. So let's just start with the PPT. So in this PPT, once we will be going through that, the student shall be able to apply knowledge and prepare patient and collect the clinical samples like blood, urine, stool, saliva, sputum, semen, and etc. for analysis. As we know, in order to perform the test, we have to collect the sample, whatever it is. So, if you are not collecting the sample properly, you might see some errors, you might see some false errors, which may give you a false result. So, it is very concerned part that we have to, collect samples clinically very precisely, and very importantly we have to follow all the safety rules, we have to follow all the rules while collecting the samples. So, blood sample collection. So, arterial blood, capillary blood, and venous blood. So, these are the three types of veins we have in order to collect the blood. So, most of the time we collect the venous blood, and it is very easy to collect the blood. Whereas the arterial blood, if we are collecting from arteries which are deep down in your, skin, and it is very hard to collect the arterial blood. Whereas the capillary blood you can take from the tip of your finger, like from here, in order to do the blood testing or some other blood sugar test like that. So capillary bloods you can do that. So for arterial blood, the what are the arteries what you have to focus on, like radial, branchial, and femoral arteries. These are the three main arteries from where we collect the arterial blood. For capillaries blood, we collect from capillaries, and for venous blood we collect from median cubital vein, which is this part from where we collect basically most of the venous blood. Site of withdrawing venous blood. So antecubital fossa area and the vein is called median cubital vein. So the vein from where we are collecting the venous blood, the vein is known as median cubital vein. But the portion, as I told you, we have to collect it from here. This portion from where we are collecting the blood, this portion is known as antecubital fossa. So you should know the which portion. The portion is antecubital fossa, and vein from where we are collecting the venous blood is median cubital vein. And now we are going to talk about the principle, like how to do and what are the principles of collecting this venous blood. So overall idea of venous blood collection of vein pincher is to collect large amount of blood from the patient to perform several tests. So whenever we have to perform a lot of tests, we always prescribe to have a venous blood, and the method all allow us to perform all type of tests in adequate blood volume, unlike capillary blood collection, which is scanty and inconvenient to perform lots of tests from a single prick. So when we are talking about a capillary one, we just do a little bit of prick and we can get like maximum 5 to 6 drops of blood. But when we are talking about the venous blood, which we are collecting from median antecubital fossa, in that venous blood we can collect a lot of blood, and from that lot of blood we can perform a lot of tests like serological tests, like biochemistry tests, like microbiological tests, immunology tests. So the amount of blood which we are collecting from here, from venous blood, from venous capillaries, is very large. So in from that the collection is very large, and you can perform a lot of tests from that. So the amount is very high as comparison to other. So now we are going to talk about urine sample collection. So urine sample collection, urine is also another, apart from blood, is also one of the most common the most common specimens we collect from patient in order to perform a lot of tests in order to check the diseases. So urine has a long rich history as a source of measuring health and well-being, and remains as important tool for clinical diagnosis. So the collection of urine is also very important. If you are not doing the collection properly, you can see some false result over there as well. So the collection should be the very first thing which you have to notice, which you have to do it very carefully, because if the collection is not good, no matter how good perform you, how no matter how how much you are giving your effort, how much you are performing well, doesn't matter. All matter is that how you are collecting the samples, and then you can perform with the test. But if the sample is not collected properly, so no matter how whatever you do, at last it doesn't matter, it will always give you a false result. So the clinical information obtained from a urine specimen is influenced by the collection method, timing and handling. So in urine, the collection always method, the timing always method, like at what time you are collecting, at like it is a mid one, it is a pre-mid, what is the time you are doing, and what are the handling, like after collection, how much time you are giving, how much time you are keeping it. So that handling always matter. So let's just talk about in urine what type of collection we can do. So one type of collection is a random specimen, routine urinalysis and a microscopic analysis. So as the name suggests, it's a random specimen. We can do it randomly anytime, after meal, pre-meal, post-meal, whenever like you want. You can do the collection of urine. That is called a random specimen. And first morning specimen. First morning specimen, as the name suggests, first morning. So the first morning when you wake up, and when you woke up, and the very first urine you have to use it as a sample. So it is always prescribed that always remove the initial urine and discard it, and what the rest collected in the urine in a urine container. So that what happened in the initial urine, there is a lot of microbes are there. So in order to remove that microbes, we discard the initial urine, and the rest we collected in your urine specimen. And midstream clean catch specimen is it's used for basically culture and sensitive testing. And the second and the last one is a time collected specimen for 24-hour specimen, 8-hour specimen are. So doctors sometimes say that you have to collect the whole 24-hour urine sample. So like you have to collect that whatever the urine is there in that 24 hours, you have to collect, and you have to collected in the specimen. It could be for 8 hours, it could be for 24 hours. For the time collection, whatever the time it is given for you, you have to collect for that particular time which is prescribed. Now urine collection procedure, like how you will be doing it, how to collect the urine. So we are going to talk about. Label a sterile screw top container with your name, date of birth and the date. So in the container which you are going to take the sample, please make sure that your name is there, the date is there, on what date you're going to take the sample, and the date of birth of the patient should be made there, so that it help in removing errors, so that it cannot be mixed with any other one with the same name of that person. So that's the best thing you can do to maintain all the identification, to make all the details of the patient in that container itself. Wash your hands in order to remove other microbes. Start to pee and collect a sample of urine midstream in the container. As I told, midstream is the one which we prescribe. Initially, we discarded. Keeping your labia spread open, urinate a small amount into the toilet bowl, then stop the flow of urine. Hold the urine cup a few inches from the urethra and urinate until the cup is about half full. So we have to make sure the very important thing while collecting urine is that sometimes what happens, like if the sample is there, we are collecting this much of urine, and sometimes we are collecting the whole. We have to make sure the urine is not little bit less, it's not more than required, it should be at least more than half. More than half means more than half. It should not be like it is totally full. So it should not be little, it should not be too much, at least it should be more than half. So always make sure that whilst you are doing the sample collection of urine, you know how much of urine it is required. You may finish urinating into the toilet bowl, screw the lid into the container shut, wash your hands thoroughly. And once you are done with the collection, please make sure that it is the container is totally tightened up. It should not be leaked. It should be tightened up, and you kept it in a safe, in a clean space, and then you can wash your hands. Now let's talk about the saliva sample. And once we are taking the saliva sample, as this COVID type, this is very common, but it is also important for most of the all lungs type of diagnosis. So saliva sample we do. So while taking the saliva, we do not have to eat, we do not have to drink, smoke or chewing gum for at least 30 minutes. So whatever you are like having it, once you are going for your saliva test, make sure you are giving at least a 30 to 1 hour break of everything. Like you can just have a normal water, but not more than half. So whenever you are going for saliva sample, make sure that you are avoiding all these things. Do not remove the plastic film from the funnel lid that contain the clear liquid. Spit into the open funnel until the amount of saliva reaches the fill line. Most people take 2 to 5 minutes to fill the tube. So what happened in that saliva tube? There is a tube which you have to fill, in which you have to fill your saliva. So at least that depends person to person how much time it takes you to fill that saliva tube. So we have to make sure whatever the limit is there, we have to fill that tube till the mark which is given, so that your amount of saliva which is prescribed, which is required for the test, it is there, so that we can perform the 100% test efficiency test. So if you can't produce enough saliva in one try, refrigerate your tube in an upright position between the attempts. You can refrigerate your sample for up to a week before needling to add it into the stabilizing fluid into the saliva. So what happens, there are some old people, or there are some people where you are not able to fill that saliva in which is acquired or a required amount. So what they do, we can keep this slide, we can keep this tube in upright position in your refrigerator at least for a week, but it is prescribed as much as before you can do it is very good. So you can do it, and that's how you can contain, that's how you can collect the amount which is required, the saliva. And these are used for the nucleic acids, hormone tests, cortisols, estrogen, and testosterone. Now let's talk about the stool. After urine, and the stool sample is also the very important and the very indicating specimens. The stool may be examined for hidden alkaline blood, fat, meat, fibers, bile, white blood cells, and sugar called reducing substances. The pH of the stool also may be measured. A stool culture is done to find out infections such as from parasite, virus, or bacteria. So stool collection is a collection which talks about more about your digestion, more about your intestine, more about your stomach. So whenever there is a problem which is related to your intestine, there is something which is resulted to with stomach pain, most of the doctors prescribe to go for a stool cell, because the stool sample talk about, you're more about bile, more talk about fibers, more about seed. So that's how the stool sample is important. Now let's talk about how we can do the collection. So we are going to perform the universal precaution. It is ask pass stool in a clean container. Again, we have to make sure whatever the container we are taking it, it's totally sterilized and it is given by a laboratory. You can't collect any sample in anything you want. The sample, the container should be prescribed from a laboratory. You should take it from a laboratory, because it is a sterile thing. Because if you are taking a collection in a non-sterile thing, there is no use. So we have to make sure the container is good, sterile enough. Stool should be collected in a sterile white mountain container, and the container should be good enough, good space. Loose large portion containing mucus, blood, etc. is to be collected in a white mortar bottle. Should be uncontaminated with urine or any other body secretion. So make sure when you are collecting the stool sample, it should contain only the stool, not the other specimens. At least the amount which we have to, it's like more than 2 grams is required. Properly named, again we have to mention whatever we are taking the sample, we have to make sure our identity is properly written over there. So at the time of performing, we are not mixing it with any other sample or with any other patient. So that identification in that container should be very clear and should be very detailed, so that it is easy to perform and it is easy to recognize which sample is of which patient. And if delayed, store in a refrigerator. Now let's talk about the another sample, which is a sputum sample collection. So for sputum, again the mouth should be punished from before sample collection. So again, at least for a half an hour, even more than a half an hour, it is prescribed not to have anything while you are going for a saliva test, or either you are going for a sputum sample. For fungal culture, 3 consecutively collected early morning specimens are recommended. For AFB, collected 3 early morning specimens from deemed cuff of 3 consecutively collected specimens, each collected in 8 to 24 hours intervals, with at least one being an early morning specimen. So we have to make sure that we know the difference between saliva and sputum. So saliva is the liquid which we have while we are chewing the food, and it's the liquid which is there in our mouth. So saliva is something which is coming from very deep in from the lungs. It's the sputum. It's the thickest mucus we have, and we are calling that sputum. Here we are going to talk about sputum. So the sputum is also like, it's from a deep lung. We have to make sure that it is coming fully, and we are, giving a good sample for sputum, and we are not having anything before while we are giving any sample collection. And this sputum is very helpful in order to detect the respiratory tract infection or TB or any most important diseases. Now let's talk about semen collection. Semen sample collection is also very important collection right now nowadays for IVF, for fertility tests. This semen sample collection should be very people should be very conscious when while will be very prescribed while collecting this semen sample collection. So semen analysis is also known as sperm count test. Analyze the health and viability of a man's sperm. So once we are doing this sperm test, we can see what is the viability of semen and what is the count of sperm. So there are two things we are doing in semen sample collection: the amount and the viability of the sperm. Semen in the fluid containing sperm that's released during ejaculation. A semen analysis measure three major factors: the number of sperm, as I told you, the movement, like the viability, and the shape of the sperm is always matter. So reason why we are doing, as I say, for the infertility case, we are doing a semen analysis is often recommended when couples are having problem getting pregnant. The test will be described by a doctor, determined by a doctor. The analysis will always help to determine if a low sperm count is there. And another reason why we are performing this semen sample collection is the vasectomic success, because when we are doing a vasectomy, we are cutting this tube so that no longer semen will produce. In order to check that, we are doing vasectomy thing, and in order to perform that whether the vasectomy is done successfully or not, we are doing a semen sample collection. So these are the some points of that. I hope we are done with this. These are the slides which I have covered. A lot of samples like blood collection, like urine collection, like stool collection, like saliva collection, like sputum collection, and the last one, semen collection. I hope you got to know that how we can do the sample collection and how every specimen is way different from another, and how it is important to collect the sample in a right way, so that you can follow the same and you can also recommend the same to your patients, to your family while doing the collection. Always make sure wash your hands, do the collection properly, give enough of your time for the collection, and make sure your identification should be there in that container, and the container should be sterilized enough to give you the sample. Thank you and have a great day. Bye bye.